Buenos días a todos y a
Good
todas y
morning,
bienvenidos a esta
everyone, and
sesión
welcome
virtual
to
de
this
prensa de la
virtual
Organización Panamericana
press
de la Salud.
briefing of
Soy
the
Ashley
Pan American
Baldwin
Health
del Departamento de
Organization. Ashley
Comunicación de la
Baldwin here from the
OPS
Department of
y es un
Communications
placer
of
estar
PAHO,
con
and it is
ustedes.
a pleasure to be
Hoy,
here
en
with
el
you
marco de la
today within the
33
framework of
Semana
the
de Vacunación en las
23rd week
Américas,
of
les
vaccination in the
presentaremos una
Americas. We will
actualización
be
sobre la
giving you
vacunación
an
en la región.
update on
Me
vaccination in
acompañan
our
hoy
region. I
doctor
am
Jarbas
here with
Barbosa,
Dr.
director
Jarbas
de la
Barbosa,
OPS,
Director of
doctor
PAHO,
Daniel
Dr.
Salas,
Daniel
gerente
Salas,
ejecutivo del
Executive
Programa
Director of
Especial de
the Special
Inmunización
Program on
Integral de la OPS,
Integral
Santiago Cornejo, gerente
Vaccination
ejecutivo
Immunization,
de los
Santiago
fondos
Cornejo,
rotatorios regionales de la
Manager of
OPS,
the Revolving
doctora Marta
Funds of
Saboya,
PAHO, Dr.
asesora
Marta
principal de
Saboya,
la iniciativa
main
de la
advisor of
OPS para
the
la eliminación de
PAHO Initiative
enfermedades.
for Elimination of
Durante esta
Diseases.
sesión de
During this
aproximadamente una
session,
hora,
which will
pueden
last
hacer
approximately
preguntas
1 year,
en vivo
you may
levantando la
ask
mano o usando
questions
el
live
botón de
by
preguntas y
raising your
respuestas Q&A.
hands or
Solo
using the
tomaremos
Q&A
preguntas de
button. We
periodistas.
will only be taking
Contamos
questions
con
from
traducción
journalists. We have
simultánea en
simultaneous
español,
interpretation
inglés,
in
portugués y
English,
francés.
Spanish,
Sin más,
French,
cedo la
and
palabra al doctor
Portuguese.
Jarbas Barbosa
Now,
para sus
I will
palabras
yield
de
the floor
apertura
to
de esta
Dr.
rueda de
Jarbas
prensa.
Barbosa for his opening remarks.
Muchas
Thank you.
gracias, Ashley.
Thank you
Muy
very
buenos
much,
días
Ashley. Good
a todas y
morning,
todos. Bienvenidos a la
everyone,
sesión
and
informativa
welcome
de
to
hoy
today's briefing
sobre el
session
estado de la
on the
vacunación en
status
nuestra
of
región,
vaccination in our
organizada en
region,
el marco de la nueva
organized
edición de la
within
Semana
the
de
framework
Vacunación
of
de
a
las
new
Américas.
edition of the
Entre el
Vaccination
sábado
Week in the
26 de
Americas.
abril y
Between
el 3 de
Saturday,
mayo,
April
los países de
26th,
la
and
región
May 3rd, the
administrarán
countries of the
sesenta y
region
seis
will
coma cinco millones de dosis de
administer
vacunas de
about
Estados Unidos
66.5
para
million
que las
doses of
personas con
life-saving
maiores
vaccines
probabilidades
so
de
that people
disfrutar de una vida
are more
sana y
likely to
productiva.
enjoy a healthy and
Ya por
productive life.
23 años, esta
For
iniciativa ha sido
23
una
years
piedra angular
already,
de la
this
salud
initiative
pública de
has
la
been a
región, al facilitar la
cornerstone
vacunación de
of public health in the region by
1,700
facilitating the
millones de personas,
vaccination of 1.2
guiados
billion
por el
people.
lema "Tu decisión
Guided
marca la
by their
diferencia,
motto,
inmunización
Your
para todos".
decision makes a
Este
difference,
año los países
immunization for
organizarán
all.
jornadas de
This year,
vacunación
countries
fundamentales
will organize
para prevenir la
vaccination days,
propagación de
which are
enfermedades
essential to prevent
potencialmente
the
mortales
spread
y
of
mantener
potentially fatal
protegidas a cada
diseases and
persona,
keep
a
every
cada
person,
familia, a
every
cada
family,
comunidad.
every community
Brasil, por
protected.
ejemplo, incluirá la
Brazil, for
jornada de
example, will
vacunación
include the
entre las
Vaccination
actividades
Week
del mes de
among the
vacunación de los
activities
países
of the
indígenas,
Indigenous
cuyo
Peoples
objetivo es
Vaccination Month,
promover la
whose
inmunización de las
objective is to
comunidades
promote
indígenas
the immunization
prioritarias.
of priority
Colombia
indigenous
llevará a cabo
communities.
una
Colombia
campaña
will carry
nacional de
out a national
vacunación en horario
vaccination
nocturno,
campaign at night,
iniciativa que es clave para
uh,
brindar
an,
mayores
an initiative
oportunidades
which is
a
key to
madres,
providing
padres y
greater
trabajan
opportunities
de
to
llevar
mothers
a
and
vacunar a
fathers
sus
who
hijos.
work to
Por
get
su
their
parte,
children
Guatemala tiene
vaccinated.
previsto
For
publicar
its
una
part,
estrategia de
Guatemala plans
vacunación
to publish a
contra el
guide on
VIH
vaccination
en idioma maya,
against the
con miras
HPV
a
in the
promover la vacunación en
Mayan
esta
language
comunidad.
with a view to
El
promoting the
lanzamiento a
vaccine
nivel regional de la
and
semana de
vaccination in
vacunación
that
se
community. The
realizará
regional
el
launch
próximo
of the
lunes
vaccination
28 de abril
week will
en
take
Panamá,
place next
donde
Monday,
se
April
garantiza el
28th in
compromiso del
Panama.
gobierno
So
panameño
I
con esta
thank
iniciativa.
the commitment of the
Asimismo, se
Panamanian
llevará a
government
cabo
for this
también un lanzamiento
initiative.
subregional en el
At
Caribe.
the same time, a
Para los últimos
sub-regional
50
launch
años,
will also
las
take
vacunas
place in
han salvado
in the Caribbean.
154
In the last 50
millones
years,
de vidas en el
vaccines
mundo.
have saved
Y en la región de las
154 million
Américas,
lives
la reducción
worldwide,
la
and in the region
mortalidad
of the
fue de un
Americas,
41%. Y
a
estas no son los solo estadísticas.
41%
Por
infant
el contrario,
mortality,
las vacunas se
or there
traducen en
has been
vidas
a
más sanas,
reduction of infant
sistemas de
mortality by
salud más sólidos
41%.
y
And these are
sociedades
not just
más
statistics.
resilientes.
On the contrary,
¿Por qué
vaccines translate
reconocer
into
los avances
healthier
de
lives,
salud en la
stronger health
iniciativa?
systems, and more
Porque
resilient
la
societies.
historia muestra que la región ha sido
Why is
líder
it so
en materia
important
de
to highlight
vacunación.
this initiative today?
Fuimos
Because
la primera
history shows
región del
that our
mundo que
region has
eliminara
been a leader in
poliomielitis en
vaccination. We were the
1974
first region
y la
in the world to
poliomielitis en
eliminate smallpox in
1994.
1974 and polio
También hemos
in
eliminado esta
1994.
región
We
al
have also
aprobar la
eliminated
prueba del
measles,
síndrome de muerte
rubella,
congénita,
congenital
tétanos
rubella
materno y
syndrome,
neonatal
maternal
y
and
los brotes
neonatal
de
tetanus,
fibromialgia
and
huérfana.
urban yellow
Y
fever
ahora
outbreaks.
nuevamente
And
marcamos el
now
rumbo. En el
we are setting
2023
the course again.
reactivamos
In
nuestra iniciativa
2023,
para la
we
eliminación de
reactivated
VIH,
our disease
un compromiso
elimination
audaz
initiative,
que
a
tiene como
bold
objetivo
commitment
recuperar o
that aims to achieve or maintain the elimination of more than 30 communicable diseases and related conditions by the year 2030, 11 of which are vaccine preventable. Now I will continue in English.
Against vaccine-preventable disease need a strong and lasting commitment to implement the appropriate public health measures. Right now, our region is grappling with outbreaks of measles, one of the most contagious diseases in the world that primarily affects children. Countries of the Americas have struggled to sustain the recommended 95% coverage of MMR, measles, mumps, and rubella vaccine, which leave us susceptible to imported cases. According to the WHO, confirmed global measles cases exceeded 359,000 in 2024. In the Americas, gaps in vaccination coverage have led to localized outbreaks across 6 countries. So far this year, 2,313 people have caught measles, compared to just 215 cases during the same period of last year. 3 people have died, and another death is under investigation, highlighting the need to urgently address immunization gaps. During Vaccination Week this year, countries plan to administer an incredible 2.7 million doses of measles-containing vaccine. When combined with microplanning, which shows us exactly where the gaps exist, right down to the community level, these efforts will help us stop the virus in its tracks. However, our work in immunization does not end with Vaccination Week. As part of the Elimination Initiative, the Pan American Health Organization is also working with countries to harness the power of vaccination and put a stop to cervical cancer, which takes the lives of over 40,000 women in the Americas each year. These deaths disproportionately affect the most vulnerable population in Latin America and the Caribbean. Cervical cancer can be entirely prevented with the vaccine against human papilloma virus and the other measures for increasing detection and treatment for the women. With a sustainable political commitment and combining high HPV vaccine coverage with new diagnostics and treatment for HPV lesions, we want to become the first region of the world to eliminate this cancer. At PAHO, we are also committed to working closely with countries in the region to address vaccine hesitancy and improve routine immunization programs, including by leveraging new digital tools. These innovations, from electronic immunization registries to geographic information systems, help us monitor coverage, identify gaps, target vaccination campaigns to where they are most needed, and respond to outbreaks more effectively. Our work to expand the access helps make the decision to get vaccinated easier by bringing vaccines closer to those who need them, including at the primary healthcare centers, mobile clinics, homes, and schools. Ensuring feasible access to vaccines in every country and territory is also crucial, and the PAHO Revolving Fund, our regional food procurement mechanism, is doing just that, providing high-quality vaccines at an affordable price to the region's countries. Without the fund, countries in our region would pay at least 75 more for the 13 most common vaccines that they use. Other regions, like Africa and the Eastern Mediterranean, have requested our support in establishing similar pool procurement mechanisms, given these outstanding achievements in the Americas. This year, the revolving fund included some of the most cutting-edge vaccines, such as the 9-valent vaccine against HPV and the 20-valent pneumococcal conjugate vaccine. The fund continues to work with manufacturers to expand its portfolio and is also supporting the development of regional vaccine production through tech transfer projects, like the recent agreement between PAHO, the government of Argentina, Pfizer, and Synergium Biotech on the PCV20 vaccine. The region of the Americas is ours to protect. But while we continue to forge our path as a world leader in vaccination, Recent outbreaks have proven how critical it is to maintain high levels of coverage to achieve and preserve elimination. We can build a stronger, safer, and healthier America by working together throughout Vaccination Week and beyond. Thank you.
Muchas gracias, doctor Barbosa. Ahora vamos a
Thank
las
you,
preguntas
Dr.
que
Barbosa.
recibimos,
Now we have a
anticipadas.
series of
También
questions
puede
that
hacer
were
preguntas en
received
vivo, levantando sus manos o
already.
a través de
They
la
were sent to
función
us,
Q&A.
but again, you can raise your hands or you can put your questions in the Q&A. First question from Blanca Valadez from the Millennial Group. She asks, how concerning are the cases of measles reported in Mexico? Is there an alert for pertussis or whooping cough? Yes, thank you very much. Over to you, Dr. Salas. Yes, Mexico has been reporting an increase in the cases of measles. Over 400 cases have been reported to date, and measles is a very contagious. It's one of the most contagious diseases of the ones that are vaccine preventables. Unfortunately, people who are not vaccinated may have deaths due to pneumonia or encephalitis. So a better organization of the rapid response teams in Mexico are underway, and PAHO is helping in that effort. It is very important to have a sensitive surveillance system. Mexico in the past was able to do a timely detection. However, the outbreak in Chihuahua needs some more work to be able to trace the cases and to do quick responses. Regarding pertussis, there is an increase in cases. Several tens of children have died, unfortunately, of pertussis or whooping cough. And it is important to do micro planning to be able to help us find those children who are in the gap, who have not completed the MMR scheme. And so having good local organizations is important. Everyone must play their role to help contain these outbreaks. Thank you very much, Daniel. Now we are going to Mar Romero from El País.
Saved lives and helped us get out of the biggest public health crisis in decades based on scientific data and research. Why hasn't this helped raise trust in vaccines? Dr. Barbosa?
Thank you. Thank you for this question, Mar Romero. I think that it was very clear during the pandemic how vaccines are essential to respond to any public health emergency. We had the development of vaccines in less than 1 year, vaccines that were very effective and helped all the countries to reduce the spread of the virus, to reduce hospitalization, to reduce deaths, and contribute a lot to put an end of the pandemic. The SARS-CoV-2 is still circulating, but now we don't have a pandemic anymore due to the vaccination that was carried out in many countries, including the countries in the Americas. However, during the pandemic also, unfortunately, we saw an increase in the groups that question the vaccines, that unfortunately spread the rumors, fake news about the vaccines. All of us, I think that remember all the very unfortunate rumors that circulated, like that the mRNA vaccines could change your DNA, that vaccines had a chip that could change your brain, and crazy things like that. So this also brought us a responsibility to work together with the countries to develop new communication strategies. I think that's important, that the Ministry of Health, the health authorities, they need to develop communication strategies that can translate all the scientific information that we have, why they need to continue, the families need to continue vaccinating their children why the vaccines are licensed, how the vaccines are licensed, what are all the processes to ensure that a vaccine is safe and efficacious. So I think that this is very important because nowadays we have more and more people that request more information. And this is their right. They need to receive the information in a totally transparent way. Health professionals has a crucial role because they are the first point of contact. They are the most trusted source of information for the families making their decisions. So this is a permanent effort that you need to work together with our member, and we are working together with our member states to strengthen this kind of new ways to deliver communication to the families, to the communities, so they can make the right decision. I think that the data that we shared about the measles, I think that they speak for themselves. Measles, in general, produces mild disease, but in some cases can produce death. And we already have 3 deaths in the region related to measles that could be prevented if these children have got the vaccine that is available free of charge in every country in this region. So it's very important to continue strengthening the trust in vaccines so we will prevent deaths and we will improve the development of the society. Thank you.
Many thanks, Dr. Barbosa. We have another question from Melina Ochoa de Uno TV. A 5 años del inicio de la pandemia de COVID.
5 years after the start of COVID pandemic, which already ended, what is the percentage in Mexico against diseases such as measles, pertussis, and other diseases such as respiratory diseases such as COVID and flu? If you don't reach the coverage levels required in Mexico, what can we do? First, Daniel, over to you. In 2023, as Dr. Barbosa said, we had a recovery compared to the pre-pandemic situation. However, it is also important to continue to work. We are not reaching 95% for vaccination schedules, which is the goal for the countries. If there are, of course, differences among countries, and it's important, but it's important for countries to be checking on their different territories, their states which have lower coverages, and for them to start working on micro planning actions together with community participation so that they can increase their coverage. Mexico has had or had a follow-up campaign to recover or to capture the children who were not covered for measles 4 years ago, and they reached 97% coverage. However, in the last 2 years reported, there has been a decrease in vaccination coverages, and this tells us that it is important that all children must have all the doses. You require 2 doses to have optimum protection against measles and to be able to achieve 95% coverage. Regarding COVID-19, it's not that we are continuing to accumulate coverage from the pandemic. We are no longer in the pandemic. In regions of high risk, we need to attain more than 90% coverage. And yes, in Mexico, they've been doing work to continue to vaccinate against COVID-19. And as our director mentioned, it is important to approach all this work. How can we do so that the vaccine reaches the population, not expect that the population comes to where the vaccines are? So we're supporting countries from PAHO in order to diversify strategies, how we can diversify the supply of healthcare in a situation where the population has different demands than we had 30 years ago, so that people can receive the vaccines and they have their full schedule of vaccination. Yes, Ashley, thank you. And thank you for the question. I would like to add something. 11 of the vaccine preventable diseases in the region of the Americas are part of the regional initiative to accelerate efforts to eliminate diseases and especially protect the achievement so far. So this initiative to maintain very high vaccination coverages is where we really need to continue strengthen vaccination, but also surveillance efforts. And this is part of the effort that the whole region is doing so that by 2030, we can protect what has been achieved, but also do other accomplishments and achievements in other diseases. So we're working together with the countries to accelerate those efforts so that they can continue to advance concretely, both at national and subnational levels. Thank you
Now we're
very
going to
much,
go to
Marta.
a live question in the chat from a journalist, web
Pregun-
activist from St. Kitts called Jermaine Abel. If you'd like to introduce yourself and ask your question, please. Thank you. No? Okay. Okay, so if you'd like to ask it later on, just let us know, Jermaine. But in the meantime, we'll carry on. So we have a question from Matías Laui from Medscape en español. El año pasado, un estudio publicado en la
Last year,
revista Panamericana de Salud
a study
Pública
published in the
reveló
Pan
que
American
Chile estaba en el
Review,
primer lugar en la región en
it
un
said that
ranking de
Chile
programas
was the
nacionales
first
de
one in
vacunación,
the region in
incluyendo variables
vaccination
como cantidad
programs,
de
including
vacunas
variables
incluidas en el
as
calendario
number of
y
vaccines
niveles de
included in
cobertura.
the
Esto
calendar
sigue
and
ahí.
coverage levels.
Hay
Is
lecciones
this
que
the
otros
same?
países de
Are
la
there
región
lessons to be
deberían
learned
tomar
by
de
other
Chile.
countries in the region? Lessons to be learned from Chile? Daniel, over to you. Yes, thank you very much for your question. Yes, Chile has done many good things in terms of vaccination. They're well organized. There is a law supporting the vaccination program so that it can work appropriately. They also have a commission that advises the Ministry of Health regarding changes in the vaccination schedule. They have a national information system. This is very important. I think other countries are trying to have or update an information system so that they can do a one-to-one follow-up, so that they can identify in the on the computer, on their tablet, on their phones, to see how many people are not vaccinated. Chile has this, and based on that law, they also have financial support. Coverage in Chile is very good. They're very close to 95% or above 95% for most vaccines. Only for the second dose of the MMR, some work needs to be done. But it's important, not only Chile. Chile is giving a good example, but other countries are also doing very well and are also an example. And they are organized. I insist it is important to be organized. Each country must strengthen their own national management and do a history and follow up what are the regions that are having gaps, because we know that even Chile, as well as it does, it has some areas where coverages are lower and there are gaps. So each country needs to do this work of follow up and determine what gaps there are so that vaccination can proceed. Thank you very much, Danielle.
To a question from Devi Shastri from Associated Press. Devi, I can see that you're connected. Would you like to ask the question live, or shall I go ahead and read? I'll give you a few seconds.
I can ask live. Can you hear me?
Yes.
Great. So it's a two-part question. One is, what has PAHO determined about how the measles outbreaks in Canada, US, Texas, and Mexico may be linked? And what ways, if any, has the US CDC worked with PAHO to share information to address these outbreaks? Is there enough cooperation? And if not, what do you want to see in terms of robustly addressing measles? Thank you.
Thank you, Devi. I'll hand over to Dr. Barbosa to start. Oh, to Daniel? Okay.
Yes, thank you for your question regarding the expansion of measles worldwide, because this is a phenomenon that is happening worldwide. It's not just in the Americas. It is usual, it is normal to have spreading through the borders and of course through the airplanes, because airplanes is the most, the easiest way to spread the virus. But of course, through borders can happen as well. So definitely this has happened in the past, the link between different outbreaks in our region. But what it is most important is the capacity of the countries to track cases, to be timely detecting any kind of suspect cases so that the actions are not going to be delayed. And of course, vaccination actions are very important, crucial to really hinder or to stop the spreading of this very contagious virus. Regarding the CDC, we are coordinating with them. And of course, it has been a long relationship, and we have a co-agreement with the CDC, and we have been working with them closely so that we can have the information and, of course, try to have a better support so that we can know the data that we are having and, of course, the actions that have been taking place on the field.
Just to complement that, as Daniel Salas mentioned, now we have the capacity to perform genomic surveillance and to identify if there are links among the outbreaks. And for this reason, we know that these outbreaks are linked, and it's supposed to happen. And the genomic surveillance network, just to tell us how we are better prepared now to face a public health emergency. Before the pandemic, only 2 countries in the region have this capacity. Now we have a network of 30 countries in the region that can perform genomic surveillance, not only to identify if a measles case is related to an outbreak that's going on in Europe or in Asia or in Africa or in the neighboring country, but also to monitor SARS-CoV-2 and other viruses that are relevant to public health. So I think that this is a very important achievement, a legacy from the response to the pandemic, and also to highlight that, yes, the CDC is sharing information with us, and this information are very important to have a regional, the regional situation, the information, PAHO shares information every week with all the countries in a very transparent way about everything that's going on in the region. A norovirus outbreak in a region, dengue fever cases in another one, avian flu outbreaks in animals in another one. So all the countries receive the information, and this is crucial to have our region together more protected against any public health emergency. Thank you.
Thank you, Dr. Barbosa. I'm going to go back to Jermaine Abel now. He sent his question in on the chat. I think there were some issues with the microphone. So he said, good morning. With the United States experiencing a rise in measles cases, is the Pan American Health Organization concerned about the potential spread to smaller Caribbean states, particularly given their reliance on tourism? Daniel, and then he has, there have been ongoing concerns about low HPV vaccination rates in the Caribbean region. What are the current vaccination rates, and what strategies should be adopted to address these challenges?
Well, thank you for your question. Regarding the situation with measles, of course, it is very feasible to have transmission from every single country in the world that has an active outbreak, and that just not applies to the US, but of course it applies to the European countries. I mean, in other continents or regions, it can happen, that spread of the virus. So of course, that's why it is truly important, as I was mentioning before, that all the systems, the surveillance systems, must be very, very adjusted, very ready to detect any case, because the difference between detecting a case in a timely manner between not detecting it and having a widespread, it can make a huge difference in terms of controlling the outbreaks. So that's why it is important to train the healthcare workers to identify any kind of suspect cases of measles, remembering that measles, it has a rash, but before that rash that starts in the head and spreads all over the body, you have fever, you have runny nose, you have conjunctivitis, and you have cough. And that occurs probably 3 to 2 days before the onset of rash. So it is important to train or to strengthen the capacities at the healthcare workers to detect in a timely manner every single case of measles. At the same time, it is important to promote communication actions at a community level so that all the people can really go to the doctor, go to a nurse, and tell them that their child, or if it is an adolescent or an adult, is experimenting any kind of rash and fever, and so that the investigation can take place and the control of the outbreak can be timely. That plays a huge difference in terms of not having reintroduction. Remember that to have a reintroduction of the virus, you need 1 year, 12 months of continuous transmission at the local level. So with this situation of the US cases, Canada or Mexico, we are not losing the condition of being a continent, a region free of measles. It takes 12 months, consecutive 12 months of continuous transmission to lose that condition. But it is important that as soon as possible, if you can control the first suspected cases, of course, the situation is not going to be wider.
If I can add on that, thank you, Jemine, for your question about the vaccination against HPV as part of one of the tools to accelerate the elimination of cervical cancer in the region of the Americas. Specifically in the Caribbean, they have started working on national plans to increase not only the coverage of vaccination with HPV, but also increasing the screening and the treatment of cancerous lesions in women in that subregion. So the elimination of cervical cancer has been strengthened in the entire region. We hope that many countries will start putting together the national strategies to accelerate access to HPV vaccine in children less than 15 years old. That is part of the tools that we have. So that is what I wanted to add on the Caribbean on HPV. Thank you.
Thank you very much, Marta and Daniel. Nos llegó otra pregunta. El doctor Barbosa
We got another question. Dr. Barbosa mentioned the revolving fund PAHO has in his opening remarks. How does this fund work to provide countries the vaccines they need at competitive prices? Santiago. Thank you very much, Ashley. PAHO's revolving fund consolidates the demand of the countries in the region. We are currently consolidating the needs of more than 41 countries and territories in our region, and we have a scale economy. So, for example, last year we bought more than 220 million doses for the region. But this is not just better conditions, better prices, but also one of the benefits of the revolving fund PAHO has is that we guarantee that the vaccines that are provided through the fund meet all of the requirements and quality standards that PAHO and WHO enforce. We go beyond demand consolidation. We also work in a very close relationship with PAHO's technical teams to make sure that the vaccines offered through the fund are aligned with the decisions and the programs in the region. Finally, I would like to underscore that this has helped us have the latest technologies in the region in connection with vaccines by means of this Pan-Americanism and solidarity within the region. This is one of the regions that has introduced new vaccines, and this is the reason why starting this year we can offer the HPV vaccine, the new valent vaccine, the 20-valent vaccine against pneumonia, and all against RSV. So this is great progress made, and the terms and the conditions are quite competitive to help the region to prevent more deaths.
Muchas gracias, Santiago.
Thank you very much,
Now
Santiago.
a question from Jacqueline Charles from the Miami Herald, who wants to know, how is US funding cuts affecting the campaigns, the vaccination campaigns? Also, specifically on Haiti, can you discuss the challenges of this initiative in the current context of gang violence, mass displacements, and closed hospitals and medical centers? Thank you.
Thank you. I will combine this question with another question from The Economist, I think, about the United... sabemos que Estados Unidos y Argentina han
We know
buscado
that the
salir de
US and
la
Argentina
OMS.
have attempted to leave
¿Cómo esa
the
política impacta el tema de
WHO.
vacunación? La
How
pregunta de
does that
Nel
policy impact on
Roche, creo, de El Economista.
the
See, about the
vaccination policy? This comes from Nelly Toche.
I think that's important first to highlight that the PAHO is an independent organization. So the US and the Argentina, they announced their intention to leave WTO, to withdraw from the WTO. We regret, of course, this. We hope that both governments, the US and Argentina, can establish a very transparent and productive dialogue with WTO in order to have them back, because this is important for the global health security. But PAHO is an independent organization, so both the US and Argentina are are member states of our organization. We receive funds from the US as a member state. The United States pay the access contribution like all the other 34 countries in the region and the 3 participant members that we have. And we also receive funds from the US that we call voluntary contributions, mainly from the USAID and from the CDC, the Centers for Prevention and Control of Disease in Atlanta. The projects with USAID were terminated. I was publicly announced. This, of course, produces some impacts on the elimination of communicable diseases and the public health emergencies department. But the contributions that we receive from the CDC, that are one of the most important funds that we have to support, to provide additional funds to the immunization activities in the regions, are still being implemented. And we are already in the negotiation with the CDC that we hope will be very productive to think about the new generation of these projects. So this, the situation now, using the funds that we have from other sources, from other donors, other sources of funds, we are not having any kind of decrease in our technical capacity to work with our member states and to support them in the process to increase the vaccination coverage, the surveillance, and the response to outbreaks in the region. Thank you for your question.
Gracias, Ashley. Tal vez para complementar es
I
más.
thank
Con la
you. And
Argentina,
also to add
solamente
to
este
this,
año hemos aumentado
Argentina
la colaboración
has
con la
had an
Argentina
increase
en relación
in
al
the
acceso a fondos
cooperation that
para
they
que
have
tengan
with
acceso a
us as to
vacunas.
access to
Y
funds,
como mencionó el
access to
director
vaccines. And
Barbosa,
as the
este año
director
hemos
mentioned,
también
this
trabajado
year
con el
we have
gobierno de
also
Argentina
worked with
y con
the
productores para
government
obtener
of
la última
Argentina and
generación
with
de la vacuna
producers to have
contra la
the latest
neumonía,
generation of the
que va a ser
pneumonia
una producción
vaccine that
regional
will
desde
be a
Argentina
regional
para el acceso
production
a
from
todos los
Argentina
países de nuestra región.
to the countries in the region.
Okay, thank you, Santiago. And about Haiti, the situation in Haiti is really a very, very complex situation that you have, as you know, the political instability, the economic crisis, the humanitarian crisis, violence, everything is working together to put a very challenging environment in Haiti. PAHO is there. We have our country office is open, working with the Ministry of Health, with civil society organizations. In Haiti, we have a warehouse where we store all the vaccines that are used in the country. It's called the Promise. And we are providing technical cooperation to the country and supporting them to work to respond to the current crisis. We were very well succeeded working with the government, but also with civil society to reduce the transmission of cholera in Haiti using innovative strategies like mobile laboratories that go to the communities affected, they test and they release the treatment immediately to these communities. So this was very important. And we are also working in Haiti, and we are keeping the only hospital with emergency room and the surgery capacity open to all inhabitants there free of charge to provide surgeries and the care for people that have wounds and other accidents and other health emergencies. So we are there, we are calling the attention of the donors around the world that we need to work together to improve the situation in Haiti. We need to work together with the government, with civil society in Haiti to keep the health services open. That is a challenge in some areas in Port-au-Prince and other cities in Haiti, but the Pan American Health Organization is there, is providing technical cooperation and working together with the Ministry of Health and civil society to respond to this very serious crisis. Thank you for the question.
Thank you, Dr. Barbosa. Ahora vamos a
Now
Nicole
we are
Ultrago de
going
Noticias
to
Caracol.
go to Nicole Ultrago
Pregunta,
from
¿cómo
Caracol
ven el
Noticias.
panorama en
What
Colombia,
is your
teniendo en
outlook
cuenta
about
que
the
se acaba de
situation in
declarar una
Colombia,
emergencia
knowing that
sanitaria por
there is
casos
a
de
health
fiebre amarilla?
emergency due
¿Es
to
posible
yellow
que se
fever
puede
cases?
propagar
Is
en
it
forma de
possible for
epidemia
this to
o
spread and
incluso
become
pandemia
an
en
epidemic
zonas
or
urbanas?
pandemic in urban
¿Quiere
areas?
empezar, Daniel?
Who would like to start, Daniel?
Sí, gracias por la pregunta. En
I
realidad,
thank
como
you for the
mencionábamos
question.
anteriormente,
As we mentioned
la fiebre
before,
amarilla se
yellow
transmite
fever is
principalmente a nivel
transmitted
selvático
in
y
the
no a nivel
jungle
urbano. Ya
rather
en
than in
las
urban
Américas logramos
settings.
en
In
los
the
recientes
Americas, we were
brotes
able
la
to
transmisión
stop
en
transmission
varias
and
personas
outbreaks
a nivel urbano. Sin embargo,
in the
claro, la
urban
situación en
areas.
Colombia viene
Clearly, the
preocupando.
situation in
Ya
Colombia is
la OPS ha
concerning.
estado colaborando
PAHO
cercanamente
has
con
been
las
closely
autoridades de salud
working
para poder
with
tomar
the
las
health
acciones que son más
authorities to
pertinentes. Claro que uno
implement
también de
the
los más
right
importantes sigue
measures.
siendo la
Clearly,
vacunación.
vaccination
Recordemos que la
continues
vacuna
to be one of the
contra
most
fiebre amarilla
important
requiere
measures,
una
and
única
the
dosis.
yellow
Eso
fever
sí, es
vaccine
importante
requires
esperar
only
al
one
menos un par de
dose, and
semanas
it
para
is
tener una
important
respuesta
to
inmune
wait for a
suficiente.
couple of weeks
Hemos estado también
until the
acompañando
right
para
immune
poder llevar a cabo
protection is created, and we have
microplanificación y
also
poder
been
determinar
working
cuál
on
es la estrategia de
micro-planning and to
vacunación que va a
determine
ser más
the
efectiva dependiendo de cuáles son
vaccination
las
strategy
características
that
de las
will be the
localidades
most
donde se están
effective
presentando los casos.
depending on the
Cabe mencionar
characteristics of the
que la OPS en estas
locations where
situaciones
we see the
recomienda el uso
cases.
de las
PAHO in
dosis
those
fraccionadas. Eso
cases
significa que de
is
una sola dosis se
is
podría administrar
asking for
varias dosis de vacuna justamente para
fragmented
poder tener
doses.
un
That is
uso
to
más
say,
eficaz y
to
poder
use one
cubrir
dose
más población.
in a
Pero
fragmented
para
or
poner eso desde el punto
segmented
de vista de vacunación,
fashion
sin
so
embargo,
as
creo
to
que hay
cover a
varias
larger
recomendaciones.
sample of the population.
Gracias, Daniel, y gracias
That's
por la
what I
pregunta
have to
sobre
say
fiebre
about
amarilla desde
vaccination, and
Noticias
I give the
Caracol.
floor to Laura. Thank you very
Efectivamente, en la
much.
región de las Américas
And
tenemos la
yes,
meta de
clearly in the
proteger el
Americas, we
logro de
have
haber
the goal of
interrumpido los brotes de
protecting
fiebre
the
amarilla en zonas
achievement of
urbanas.
interrupting
Los
yellow
países que
fever
han sido
transmission in
históricamente
urban
endémicos
areas.
están
And
reforzando en este momento
historically,
todos
endemic
sus
countries
esfuerzos
are
que
now
incluyen no solamente
reinforcing
la vacunación,
their
sino
efforts
las medidas de
beyond
prevención y
vaccination to
protección en una
include
enfermedad en la que
protection,
sabemos que el ciclo
prevention
selvático es
for a
muy
disease
importante. Entonces, proteger ese
that
logro,
has
no
a
solo Colombia,
very
sino los otros
severe
países que
cycle in
este
the
año han
jungle.
estado
We need to
notificando
protect
casos,
those
están
countries,
haciendo
not
ese
only
mismo refuerzo.
Colombia,
Por
there are
supuesto,
other countries that
significa
have
una
also
alerta, un
reported
riesgo y
cases.
desde
This
la
is an
Organización
alert.
Panamericana de la
This
Salud
is a
estamos
risk. And
apoyando a
from
los
the Pan
países para
American
que
Health
se
Organization, we are
proteja ese
supporting the
logro y
countries so that
logren
we can
controlar
protect that
los episodios de
achievement and we are able to control those cases.
Muchas gracias, Marta y
Thank you
Daniel.
very
Nos
much,
llegó otra
Marta,
pregunta
Daniel.
de
We
Nelly
have another
Toche,
question
que
from
me
Nelly
parece bastante
Toche,
interesante.
which seems
¿Preocupa
quite
el regreso
interesting.
de alguna
There is
enfermedad más
is
aparte
there a
del
concern
gripe
about the
anterior,
return beyond
específicamente por
measles of
vacunas?
any other
¿Hay
disease,
alguna
any
vacuna que tenga escasez
disease
mundial
that
o
is
en la
usually
región?
vaccinated
¿Quiere
against?
empezar,
Is there
Santiago?
any
Sí, muchas
disease
gracias.
that is a
Hoy voy a
concern
hablar un
in the
poco sobre
region
el tema
or
de la escasez.
globally?
Creo que es
I am
importante
going to
delinear
refer to the
que la
scarcity
producción de
of
vacunas es
vaccines. We need to
extremadamente compleja.
understand that
También
vaccine
hay una
production is
evaluación
extremely
constante para
complex. There
asegurarnos
is
la calidad.
an ongoing
Por ende, una vacuna
examination
no
to
se puede
determine the
fabricar
good
de una semana a
quality of
otra,
the
sino lleva
vaccine,
mucho tiempo
and a
para
vaccine
poder fabricar
cannot
una
be
vacuna.
produced
Y es
overnight.
ahí que
It
es muy
takes
importante
a
que
long
haya
time.
una
And that's the
planificación con
reason
tiempo
why we need
para
to
poder
have
asegurar
careful
el
planning
suministro
to
de las
be able
vacunas. En estos
to
momentos
guarantee
hay limitantes de
vaccine
vacunas
supply. Right now, we
relacionadas
have
a
some
fiebre amarilla.
shortages for
Obviamente
yellow
los brotes de
fever
infección
vaccine.
han
And as
aumentado la
to
demanda y por eso
measles, we
hemos
have
hecho
seen an
en los fondos
increase in the
rotatorios
demand
y gracias a las
for vaccines.
flexibilidades
So
que nos
because
dieron
of the
los Estados miembros,
flexibility that the
hemos logrado
member
reservar dosis
countries
en
gave us, we were
sarampión
able
para
to
asegurarnos
reserve
más
some
allá
doses of
de
measles
la
under
demanda que
the
tenemos.
revolving
Tenemos
fund
un dinero
framework so that we have reserved stock to be able to provide timely response in case a country may require additional measles doses. Thank you, Santiago. Dr. Barbosa, would you like to add something? Some diseases are vaccine preventable, and their incidence is so low that they are not striking. For example, whooping cough was never eliminated completely, so we hear that it is returning. Well, it never left in the first place. So some of the vaccines that were not eliminated are under control, and now they have an incidence that equals 2% of what we had 20 years ago in the region. But if the vaccination coverage goes down, and if we have communities, populations with low vaccination coverage, that may clearly be the source of an increase in the cases. So except for smallpox that was completely eradicated in the world, there is no chance for this disease to come back. For example, if we think of polio, that we eliminated measles, and as Daniel Salas mentioned, eliminating measles means no indigenous transmission within 12 months. In the case of polio, we still have it in transmission in 2 countries. They are close to elimination, but they are not yet. So we cannot lower our guard. We need to continue to be alert. All of the vaccine preventable diseases need to be constantly under surveillance, and they should also be on our radar to identify who the members of the population are that are not vaccinated, so that the ones that are eliminated continue to be eliminated, and the ones that are under control continue to have low impact because the number of cases is very low and the condition continues. Thank you very much. Thank you, Dr. Barbosa. Now we have a live question by Bessie Granja from Ecuavija.
Hola, muy buenos días. Muchas gracias.
Good morning. Thank you very much.
Justamente quería preguntar a las autoridades que a 5 años de la
I
pandemia,
have a
¿cuál es el
question for the
actual
authorities.
desempeño de la
5 years
vacunación
after the
de
pandemic,
Ecuador
what is the
respecto a
current
estos
performance
porcentajes
in
para
terms of
prevenir enfermedades como
vaccination in the
sarampión,
case of
tosferina,
Ecuador, for
tuberculosis,
example,
COVID-19,
to
fiebre
prevent
amarilla, los
COVID-19,
humanos y
yellow
otras
fever,
enfermedades? Y también,
HPV,
además de saber
measles,
cuál es el
chickenpox,
desempeño de
and
Ecuador
also
en
what
esto,
is
¿qué recomendaciones debería
Ecuador's
implementar el Estado
performance?
ecuatoriano?
What
Porque
are
hay
the
localidades que están ahora muy cercanas a la
measures
frontera
that
con
need to
Colombia,
be
y los
implemented in
casos de
those
fiebre
areas that
amarilla
are very
están
close to
preocupando? Muchas
Colombia,
gracias.
given the yellow fever cases,
Gracias,
which are
Daniel.
concerning? I thank you. Daniel, would you like to start? Yes, thank you very much. I would like to start from the end of your question. Having such an effective vaccine such as the yellow fever vaccine, the most important measure to protect the population, in this case Ecuador, is to review the vaccination schemes in those cases where you have an important and significant transmission risk. It is important to have updated vaccination systems, because if this is applied, the vaccine is applied correctly, you can achieve higher than 95% effectiveness. You also need to review all of the other vaccination schemes. And in the case of COVID-19 vaccine and influenza, these are coverages that are not as high as the ones that we have for children. For example, SARS-CoV-2 and flu are not going to be eliminated with the vaccine, but the vaccine is going to give very significant protection to diminish acute cases, hospitalizations, and eventually deaths. In particular, for those individuals that have risk factors, older adults with high blood pressure or chronic respiratory problems or heart issues, these individuals are quite vulnerable to the diseases. So we cannot wait for the COVID-19 coverages to be higher than 95%. They will always be at 80 and 90%. The same applies to the flu vaccine. But the idea is not to eliminate, rather to prevent severe disease and hospitalization. And as to the other vaccines, the situation is the same. The countries need to assess the strategies to determine who the members of the population are that are not vaccinated. This is 2025. This is a good time for the countries to have a consolidated, solid system that is operating with other surveillance systems, for example, with birth systems to determine where those individuals that are unvaccinated are. And now we have text messages, emails that can be perfectly linked to these nominal electronic records, the records that have the information about each individual. And we have also been implementing tools in the countries based on AI with open data layers for detection of unvaccinated individuals using geolocation. So we can use georeferencing to better plan our strategies to get to those territories. In Ecuador and in any other country, it is important to review the vaccination schemes and also the strategies that we can use to get to the population. Thank you very much, Daniel. We are coming to the end. I think that we have some time for two additional questions. I am going to give the floor to Chloe from Beja, Brazil.
Hello, good morning. I hope you can hear me. This is a question for Dr. Jarbas. We are seeing in the US the intention of the CDC to revisit the relationship between vaccines and autism, and the relationship and the belief in that relationship growing. So I would like to know if PAHO has specific actions to fight vaccine disinformation in this new digital world.
Thank you, Chloe. That question is also related to another question by Jeremina that is asking about disinformation about vaccines and whether this has an important impact on the levels of vaccination. And I give the floor to Dr. Barbosa. I thank you, Chloe and Guillermina. Guillermina, I think it's going to be easier if I understand, if I answer in Spanish. Disinformation has a role, but that is not the only problem we have. We have more than one. We have more than a problem. For disinformation, it is important to have renewed vaccination strategies. In the past, I think that individuals had so much faith in other vaccines that they only learned whether they had to be vaccinated or not, and that was the only information they needed. But now we need to have information strategies that are closer to the society. We need to reach out to the population, individuals who can also be heard, and also why they need to continue to be vaccinated if the disease has already been eliminated, and how is it that we can make sure that the vaccine is safe, is a quality vaccine. So that is something that needs to be done on a daily basis, because that means, let's say that there is a rumor or fake news about a vaccine, that has to be addressed immediately. Another important aspect has to do with health professionals. Throughout the surveys, we see that the main source of mistrust or trust to make a decision on vaccination comes from health professionals. Several health professionals lack all of the information as to how the vaccines are produced, how the quality is guaranteed, and also why we continue to vaccinate. It is very important to work by training our doctors and other health professionals so that they can have the right information, because if families ask a cardiologist, an obstetrician, or any other doctor whether the person has to be vaccinated, and this doctor professional does not have the proper training to answer the right information, this will be a problem. But there is also a second aspect, and it has to do with the organization of the health services. I mentioned the campaign that will be launched in Colombia with night vaccination, because in large cities, if the health centers are only open 8 to 5 Monday through Friday, a family in which the father and the mother work will find it very difficult to get vaccinated. The situation changed 20, 30 from what we had 20, 30 years ago, and to lose 5 or 10 days a year to vaccinate a baby may be a burden for that family. So we need to have open health centers during the weekends and in the evenings so that we can properly have strategies. We need to identify unvaccinated communities and go from one house to the other on a Saturday or Sunday to vaccinate. Today, it is no longer possible to think that everyone will have the same opportunity to go to a health center. Even those who want to get vaccinated sometimes cannot go take the bus because they are part of the gig economy, they are part of the informal economy, they do not have enough funds. So these are all of the determinants that do have an impact. We also need to review the organization of the health services to remove access barriers. Now, as to autism and vaccines, I think we have great evidence that shows us clearly that there is no link between vaccines and autism. Autism has a very important, significant genetic relationship, and there are also other studies that may further clarify some of the environmental risk factors. But with the vaccine, I would say there are thousands of pieces of evidence that show that there is no relationship between vaccines and autism. There are even very important pieces of research on families that had vaccinated and unvaccinated children, and this clearly showed that this was not related to having the child vaccinated or not, rather to the genetic history. All of the information that can be obtained to clarify the risk factors for autism can be greatly useful. This can help enlighten the population about this, but we need to be careful because this has been clearly established. We need to be careful because we cannot lead people to think that, well, there may be some relationship. We need to manage information very carefully so that the research that is necessary for autism does not contaminate all the trust that we need to have in vaccines. There is no relationship between vaccines and autism, and this was clearly determined by the scientific community with properly conducted research that clearly shows that there shouldn't be any doubts about this, and I thank you for your question.
Thank you, Doctor. We have a last question from Judith Herrera from El Mercurio, Chile. She asks, what measures can be taken to encourage people to get vaccinated, especially against COVID-19? Because at this point in time, there are winter campaigns, and there is a campaign for immunizing against coronavirus, but there is vaccine fatigue, and people are not very quick to get vaccinated. What can we do? Thank you. Over to Daniel. Yes, it is important to carry out pre-planned activities. And we could use the vaccination week to do that. It is important to take advantage of social media to disseminate the importance of vaccination, especially if there are leaders in the community who are credible and who are trusted. As Dr. Barbosa mentioned, healthcare workers should also convey that trust and we are also working with them to strengthen their capacities so that they can continue to educate people, telling them that 150 million lives have been saved thanks to the vaccines. They are effective. They are really strong ways to prevent disease and death. So yeah, you can go to shopping malls, having open health centers during the weekends. Maybe if the family is in these places like shopping malls, maybe they're not seeking to get vaccinated, but if you have a vaccination post there, it will increase the ability for people to get vaccinated. And so that is a good idea to continue vaccination. Thank you, Daniel. Now I will give the floor back to Dr. Barbosa again. This is the end of the briefing, the press briefing. Thank you very much, Ashley. Yes, I would like to issue an invitation. The region of the Americas, as I said in the beginning, has achieved many successes in vaccination. We have recent milestones. As you know, COVID-19 had many negative impacts. But as we know, many health centers had to close. Health professionals were transferred from hospitals to emergency centers. People were afraid to go to the health centers to get vaccinated during the peaks of transmission. But I am very pleased to acknowledge that our region, the region of the Americas, is one of the regions in the world that is recovering the fastest from the negative impacts of the pandemic of COVID-19. And we have reached the period or the same level as we were before the pandemic, but we want to continue improving. We need to increase coverage of vaccination to protect boys and girls against all the diseases. And we have a tool. It is the most fantastic tool in public health. It is the vaccines. So during this vaccination week, we should have strong mobilization, not only by governments, but also by the society in general, the communities of different scientific associations and colleges, Rotary and other service clubs. They have been very critical in vaccination campaigns, churches and other civil society organizations that will facilitate vaccination of boys and girls. We cannot accept that children are dying, and 3 have died in this region when we have a measure that is available, that is accessible, and that can save lives. It is a moral and ethical imperative that we have so that all of us have the access. Everyone can have access to vaccines and they can be protected and they can live their lives in a healthy way. It is an invitation issued by the Pan American Health Organization, and we will be working with other countries to strengthen, as we do this today already, to strengthen immunization. And during this week, it will be a time to call your attention to focus on this measure of public health that is one of the most effective. It has saved hundreds of millions of lives. We're going to strengthen even more our commitment to vaccination. And thank you very much for your attention. Thank you, Doctor. And this is the end of the press briefing today. We thank Dr. Barbosa and the rest of our spokespeople and the journalists that have been connected today. For any questions, further questions, or to request an interview, please reach us, media team at paho.org. Thank you.